If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to the season premiere of our 10th season. I hope you all had a healthy Christmas and New Year celebration. This series was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those of you who are not new to our show, there are two ways to get your questions in. One, by calling the number on the bottom of the screen, and the second is by visiting our website at netny.net/askthedoctor. You can submit your opinions or questions via the forum. For this episode, I have Dr. Anastasia Nikitina, attending in cardiology at New York Methodist Hospital. I have Dr. Margarita Kotsina, geriatric medicine attending at New York Methodist Hospital. And next to her, I have Dr. Daniel Stevens, a laparoscopic surgeon at Metropolitan Hospital. Welcome to all of you, and thank you for being here for this kind of a momentous occasion. For those of you who are out there, you know that this Ask the Doctor series has been on for quite a while. I know Monsignor's been here, Monsignor Bennett, every show for 10 years. And I remember back to the early days, and I thought it would be interesting just to tell how this show actually came about. There was a show, the old Catholic medical centers had rented time at the prayer channel, as it was known at the time, and they had a show called The Medical Ethicist. Now, nobody could say that name, which was a big problem, called The Medical Ethicist, and nobody exactly knew what it was. So they had a lovely host. She went through the first show and had 3 phone calls, and the second show she had 1 phone call, which was a wrong number. So they decided that they were going to cancel the series. And I said, well, wait, as long as we pay for it, let's have an Ask the Doctor question. And John Kelly, who should rest in peace, bought into the idea. He was our producer, and the rest is history. Here we are 10 seasons later, and I thought it was interesting what these shows have in common. Family Matters, remember, with Urkel, Steve Urkel, One Day at a Time, All in the Family with Archie Bunker, Friends. Those shows didn't make it to 10 years. They made it to 9 years. So we've actually surpassed, I see you're very impressed with that, Dr. Katsina.
Oh, yes, absolutely.
Okay. But it's quite an accomplishment, and I'm glad that everybody's been here, and hope we go another 10 years. So now for In the News, now that you had that little bit of trivia about Ask the Doctor, in the news, the top 5 advances of the past decade, because we entered a new decade, H1N1. And even though we got away with it, we lucked out that it wasn't as dangerous or virulent as we thought it might be, it helped to prepare us for the subsequent pandemics that we may get, so that it showed us that we needed to communicate better with the countries. We needed to get better vaccine methods, and we needed to get better testing to know how we can detect where the virus was. The second big advance was that the human genome was decoded, so that all of the genes in the body now are decoded, and we can maybe pick out genes associated with cancer, for example, and help to develop medication so that people won't get that disease. So it's a very big, there are also ethical issues that, you know, it's a longer discussion, but has to be used properly. Number 3, cancer vaccine. That cancer vaccine will wipe out cervical cancer, and new forms of cancer treatment in which, instead of chemotherapy, which kills good and bad cells, chemotherapy that targets only the cancer cells. So that's a major advance. The fourth one has to do with smoking. The public ban on smoking has definitely cut down on secondhand smoke, and actually has motivated many people to stop smoking. And as a result, we've seen a decrease not only in lung cancer, but in deaths from heart attacks, strokes, things that smoking is associated with. And the fifth advance was a 40% reduction in deaths from heart attacks. And it has to be the way we treat patients when they come to the hospital to the emergency room, for example, with a heart attack. Instead of just giving them medicine to make their heartbeat regular and some pain medicine, we now can do angioplasties, we can give clot-busting medications, and we have new drugs like Lipitor, statins that help to prevent this buildup of plaque. So these are major changes, and this was the past decade. So it was quite a decade in science. 2 things that came up today. 1, new recommendations for mammograms. I'm sure every woman out there is totally confused. One day they're telling you, get mammograms, not get mammograms. Study today clearly showed that mammograms help cut down the deaths by about 30% in those from 40 to 50-year-old category. So therefore, the guideline says starting at age 40, you get a mammogram every year. We have now MRI and sonograms, which your doctor may use for dense breasts or for difficult cases. But definitely mammograms help, and you should continue to get them. And then an interesting study showed that people who quit smoking had an 80% increase in diabetes develop over the next few years. And when you look at it, it makes sense, because when they stop smoking, they eat more. The appetite suppressant is gone when they stop smoking. So the message is not to stop smoking, because that's very important, but the message is to realize that you may gain a lot of weight when you stop smoking, and it's important to put in weight loss strategies. And the nicotine, the gum and the patches seems to help cut down on the appetite. So now we go to one of the most popular parts of this show, is the quiz for the all-important plaque. And an announcement this year, Miss Lapatosa, Linda Lapatosa, has become the executive quizmaster. And she has come up with a hard one for us tonight. Question is, what English word consists of 3 letters, goes from 1 syllable when you say it, to 3 syllables when you add 1 letter to it? So again, an English word of 3 letters, that's 1 syllable when you pronounce it. When you add 1 letter to it, it now becomes 3 syllables. What word is this? Okay, and again, this is for that all-important plaque, which is coveted. So now our phone number is 718-499-6101. And we're going to meet our guests when we come back. I know many of you know these guests, but you can call and talk about cardiology, geriatric medicine, and laparoscopic surgery. So let us take a short break. When we come back, we'll go right to the phones. And once again, the phone number is 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor. Our topics are cardiology, geriatric medicine, and laparoscopic surgery. And the number to call is 718-499-6101. We got a busy phone lines going, but let's meet our guests. Hi, Dr. Nikitna, and welcome you back. I know multiple appearances in the past. I would like, in the field of cardiology, in the last 10 years, what do you think was the major advance?
I'm glad that you mentioned in the beginning that the death rate from heart attack decreased significantly. And this is probably was the revolutionary changes in the cardiologists, because we have on all levels of cardiology, we had improvement. Starting with medications, there are 5 new, or let's say improved, type of medications, statin, including beta blockers, ACE inhibitors, which now we know, based on multiple clinical trials for 10, 15 years back, we know that they improve survival, and we know that people who take this medication will live longer. Also, this medication protects from clot formation and slow down the progression. In terms of technologies, we have we moved from a regular stethoscope to better technology to diagnose coronary artery disease. And we were talking about this multiple times. The stents is a little metallic mesh, which we put inside of the vessel, which is already clogged, moved from bare metal, which were just simple metallic mesh, to improved. We know that now they're keeping vessel open for a longer time. And even in a surgery, in the open heart surgery, when they create a new conduit for vessels, we have changes from a big, major surgery, multiple centers in New York, including doing robotic technology. So they just do several holes in the chest, and they can place new vessels for the heart.
Amazing. And I know your office is amazing. You have the latest equipment. I went there, actually, and saw a CAT scan that does the heart. That's why, I mean, a tremendous place. They treat you well, and top-notch pictures. So it's great to have you here. And you just got back from skiing?
We did. We went to Vermont.
Your kids are doing well?
Yes.
Very good. So now we're going to get to Dr. Katsina, who does geriatric medicine, dealing with people over what age is her?
Over 65.
Over 65. So what do you think was the major advance in your field in the last 10 years?
The major advance in the field of geriatrics is the formation of a geriatric medicine as a separate field of medicine. And now the doctors are required to take the special board, the separate board, to be able to practice geriatric medicine.
Oh, so it's actually the specialty itself, becoming a big specialty.
Right, right. And as baby boomers age, and it's more and more baby boomers enter that age of 65 years old and above, and specialty is becoming more and more popular and more important.
And your office, I know for those, is on Avenue J, right? In the old movie theater.
Yes.
I
Yes,
spent many afternoons I was rebuffed by some dates in that theater. I just won't go into detail, but it was, anyway, thanks for being with us again.
Yes, thank you for inviting me.
And Dr. Stevens?
Yes.
I know as a surgeon, there's been a lot of advances in the past 10 years. What one would you pick as the number one?
Well, undoubtedly, it's the technological advancements that have been made in minimally invasive surgery over the past 10, 20 years that have allowed more and more procedures to be done minimally invasively in a minimally invasive fashion, allowing for less pain for the patient, faster return to work, and overall patient satisfaction. And this has been applied to general surgery, cardiac surgery, neurosurgery, vascular surgery, so it's really widespread, and the advancements hopefully keep coming over the next 10 years.
So you can have your appendix out and still wear a two-piece bathing suit.
We can get you
not
there,
you,
yes.
not you, but in general. But no, thanks for being with us again, and we'll talk a little bit more, but the phone lines are so busy. So one of the things we like to see, who's our first caller? Who might it be on line one? And probably for the last 10 years, the leader has been Maddie. I don't know if it's Maddie, but let's find out. Hello, hi, who is this?
Hello?
Yeah, hi, who is this, please?
This is Madeline Mara.
Madeline Mara. Hi, Maddie.
Hi.
How was your New Year's?
Oh, please.
What? Did you have a nice celebration?
Yes.
Very good, very good. And we're glad to have you with us at the start of our 10th season. And what's your question?
My question is that a lot of times my fingers get ice cold.
Okay, so your fingers get ice cold, right?
Yeah.
Okay, so let's see if that might be related to cardiac problems.
May I ask you, do you smoke?
Maddie, do you smoke?
What?
Do you smoke?
Do I what?
Do you smoke?
No.
No.
Never.
No.
I hated it.
She hates smoking. Okay.
Okay, occasionally there is a change in neural regulation of the vessels, of the hands, which can dilate or constrict the vessels. So in situation, if you rarely have cold hands, we try to do something non-medicamentously, obviously, in the beginning to keep them in the warm, to do two small motion of the fingers to prevent, to actually improve the blood supply. If this doesn't help, so sometimes it's helpful actually to go and check the blood supply to the hands. Occasionally, very rarely, there are diseases which are leads to the blockages in the small vessels in the hands and can lead to the situation like you're explaining.
But anyway, Maddie's doing very well. You're 85 years old?
I'm 88. I'm going to be 89 this month.
Can you believe that?
This is excellent.
Excellent, Maddie.
I can't believe it.
That's fantastic. And you'll be with us another 20 years. Okay?
Yeah.
Maddie, thanks for calling.
You're welcome.
Happy New Year. You know, talking about New Year, we make resolutions. I'm going to see what our callers, instead of restaurants, we always ask for restaurants. Let me see what our callers have resolved for the new year. I'm going to go to Lucille. Hi, Lucille.
Hi, Doc.
Hi, Lucille. Where are you calling us from?
Middle Village.
Middle Village, nice area of Queens, right?
Yes.
So tell me, what's your New Year's resolution?
Well, listen, I'm going to be 80 years old,
Wow.
and it's just to stay well. I want to stay well.
To stay well.
Yes.
It's a good resolution.
I'm having a little problem with my groin.
Can you speak up a little bit?
Yes, I'm having a little problem with my groin.
Okay.
Okay. Now, it started like hurting a little bit, but now I felt on my inner thigh, on the top of my leg, on the inner thigh, there's like a little round ball, but it's very soft and all. It hurts a little bit. See, if I sit down doing nothing, it don't hurt. But if I get up to walk, or if I have to bend where my belly hits my leg, it bothers me.
Lucille, let me ask Dr. Stevens if anything comes to mind with his groin pain, a little egg-shaped mass.
Hi, Lucille. How are you?
Hi, Doc.
Good. So it sounds like you may have a hernia. Sorry, my voice is a little scratchy today.
Yeah, no, me too. But it's on the side of my leg.
Does it get bigger and then get smaller throughout the day?
No.
Okay.
I don't know.
There are certain kinds of hernias. It sounds like it may be a hernia, specifically what's called a femoral hernia, which can happen just like you're describing on the inner thigh. Is that where it is?
Yeah, on the inner thigh, right.
Yeah. So you should definitely, I would go see your doctor, your primary doctor, or make an appointment with the surgeon, because if you do have a hernia there, it needs to be repaired so nothing gets stuck in it. That's the danger of having a hernia. You can get things stuck in there like your intestines, and that could be a real emergency. So you should definitely go see somebody and get a good examination.
So what would that be, an operation?
Well, it might require an operation if that's what you have. It's not a major operation. It would be a small operation.
Oh, I see.
But it definitely should be looked at.
Really?
Yeah, you know, it's nothing too serious, but I recommend having it checked out.
Because I'm prone to boils. I get a lot of boils, you know, like... And
yeah, if it's on the skin...
I was taking an antibiotic for it.
If it's on the skin, it might be a boil too, and in which case you need to see a doctor also so they can lance it and put you on antibiotics.
It's under the skin, though.
Okay.
It's under. Yes.
Give us a call and we'll be happy to get your referral, because it can be treated, but left untreated, it might cause you a problem.
Yeah, okay.
Okay, so Happy New Year.
Same to you. I'm a first-time caller, and I love your show.
Oh, thanks a lot, Lucille. Take care. We now go to Bill. Hi, Bill.
Hello.
Where are you calling from?
Astoria, New York.
Astoria, one of my favorite areas. Piccolo Venezia. Does that ring a bell?
No. I have home cooking. My wife.
Okay. What's your resolution?
Staying alive. I'll tell you why. Should I tell you why I'm calling?
I'd like to hear why.
Excuse me?
Yes.
Well, because of December 22nd, I had a heart attack and a stroke, and they took me to Mount Sinai Hospital in New York, first there in Queens and in New York. Then they told me that I had my heart stopped beating twice in the hospital over there.
This past December 22nd?
Yeah, no, the last December. It's a year.
A year ago?
Yes, and yes.
Wow,
no,
that is amazing.
And I know it's by the grace of God, because I used to walk over the 59th Street Bridge and back and everything. But that's not the thing that's bothering me now, too. I have the hernias, too. My testicles are swelled up. I have a defibrillator, and the doctor, my primary doctor, says they can't do nothing about the hernias because of my heart. So, would walking affect the hernias, making it get bigger?
Bill, let me get a second opinion on this. Dr. Stevens, he has abnormal rhythms, the defibrillator. Can he get surgery?
Yeah, well, this is always a complicated situation. Obviously, the hernias are uncomfortable and make it difficult to get around, and can be dangerous. But to have a surgery which could affect your heart, it would be even more dangerous, possibly. So really what the doctors are probably telling you is that they want to make sure that your heart is in the best possible shape that it can be before you have any type of elective surgery. So while the hernia is uncomfortable and can cause problems, it's not really an emergency, so you should make sure, talk to your cardiologist and your cardiac surgeon, that your heart is in the best possible shape and that they do all the studies that they need to do to make sure you're at the lowest risk possible before you have any sort of hernia repair.
So, Bill? Bill?
Yes.
Hi, it's a great story. I'm really glad that you had such a happy ending to what could have been a disaster, and that you're in there fighting.
Yeah, congratulations on 10 years that you got.
Oh, thanks a lot, Bill. And you continue to listen to us, okay?
Yeah, I couldn't get through all the time. I got through once when Dr. Cassina was on. That's her name?
Yeah.
You do something
One time.
more.
But I want to ask the question one more time. Is walking gonna hurt my hernias?
Well, no. The hernias may get bigger over time, but if you have to walk, you have to walk. So what you can do is there are certain devices. You can go to your surgical supply store that'll make it more comfortable for you to walk. And in the meantime, that's what you should do. And try not to lift anything too heavy. But, you got to do what you got to do.
Great. Have a great New Year. We're now going to go to Marie. Hi, Marie.
Oh, hi.
Hi. Can you talk up a little bit? Because
Yes,
it mic's a little low tonight.
Could you hear me?
I can hear you. Where are you calling us from?
I'm calling from Brooklyn, Brighton Beach.
Brighton Beach, great area. Not
Thank
far from
you.
Dr. Nicotina's office on Ocean Parkway down there.
Oh, okay.
Did you ever go into a Taste of Russia?
Not really.
Great store. You're going to love that if you go in there. Really high scale, upscale appetizing store.
Oh, okay.
So what's your New Year's resolution?
To lose weight.
Oh, how much do you want to lose?
50 pounds.
50? Wow.
Yeah.
Answer is here.
That's great. So how do you propose to do that?
Well, I've already lost 30 pounds on my own. I do a considerable amount of walking. I do about 3 miles a day, but because of this cold weather, I couldn't do it for a week or so, but I want to go back to walking.
On the boardwalk?
Yes, I do 3 miles every morning.
Wow, that's very nice.
Yes.
So,
I have a question, though, to the doctor.
Okay.
I don't know if age is relevant or not, but I'm going to be 61 at the end of this month.
61?
Yes.
Wow.
And I've been diagnosed with arthritis throughout my body. Several years ago, about 2.5 years ago, I heard a clicking sound in my knee, and I tried to nurse it myself, but it didn't help, so I proceeded to go to an orthopedic doctor, and at first he thought it was nothing. So he did an X-ray. He saw that I had a knee spur. Then after that, he did an MRI, and it showed that I had stage 3 arthritis with the beginning of the breakage of the patella. So I was devastated. I thought I needed a knee replacement. He said no, lose weight, which I did, and I started doing a lot of walking. My knee's fine, but then I developed arthritis in my neck and in my sacrolumbar area, plus I have a bulging disc. And then after I got the flu shot in October, and I don't know if it has anything to do with the flu shot or the fact that I had a severe arthritis in my neck because I couldn't move my neck, and this was going on for quite a few months, and I just ignored it. So I wind up with a frozen shoulder now.
Well, you've had a rough time.
Well, I'm going for physical therapy, and I'm doing certain exercises, and it's gotten somewhat better, but it's been a very long time since October. So I just want to know, how long does it take before this resolves? I'm assuming maybe in the summertime when it starts to frost. I don't know yet.
Well, let me ask Dr. Katsina what she thinks about this migrating arthritis here.
Yeah.
Right. It's it's a very good question, and it's a very difficult question because unfortunately we don't have a lot of means to fight osteoarthritis. Now, have you been seen by the neurologist or the rheumatologist?
No, I've only seen the orthopedic doctor and my internist.
Right. What I think is now, was your shoulder checked?
Well, yeah, both doctors checked. At first, I thought it was because I had the flu shot. As soon as I got the flu shot, I started screaming. I had excruciating pain in my arm. The pain was unbearable, and then I just couldn't move my arm. I mean, I could elevate my arm, I could extend it, but if I have to, snap my bra, I can't turn my arm completely backwards. But now I have some mobility. It has improved.
Right. Generally the flu shot does not cause that type of side effect.
No.
And apparently, based on the symptoms that you're describing in your shoulder, there is a problem in your shoulder. It could be the problem in the joint or in the muscles surrounding the shoulder.
Right.
I think it's usually recovering from arthritis or improving. Usually takes a lot of time. It's very good that you're seen by your doctor and there is orthopedist involved. The best possible medication, the best possible treatment, if it helps you, is just keep doing the physical therapy, exercise. Sometimes yoga is very helpful, but it should be done only by under the supervision of your doctor.
As I age, will this disease get progressively worse?
Is this going to get worse as she ages?
It may, because osteoarthritis becomes more and more common as people age.
Well, yeah, we have to move on because we have to pay the bills and go to a commercial. But
okay,
we want you to call back
much.
next week, okay? And let us know. We have actually a rheumatologist next week with us.
Oh, okay, I'll call then. Thank you.
And I wanted to ask Dr. Nicotina one question before we go to the break. People with arthritis and heart attacks, heart disease, how do you get them to exercise?
First of all, if they have heart disease, I want to make sure that they are safe to go to exercise. So we need to risk stratify them. I usually walk them on a treadmill, make sure that their blood pressure is really controlled, heart rate does not go too high. And if everything is stable, if I need to add some blood pressure medication, then I let them walk and achieve the heart rate, which is helpful for the
But they
conditioning.
should check definitely before they do it.
Absolutely, everyone.
Okay, so we're going to go to a commercial break now. And when we come back, we'll be taking more of your calls. Now, the phone number is 718-499-6101. Remember, you can talk about cardiology, geriatric medicine, and surgery of all types. So we'll take a short break. Don't go anywhere. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Well, we're right back. I want to just remind you out there the quiz question for those who haven't gotten the answer yet. It's a English word of 3 letters, 1 syllable when you pronounce it. Now, when you take another letter and add it to these 3 letters, you actually get 3 syllables formed. What's the word? All right, we'll see if any of you guys out there can get it and get the all-important plaque. In the meantime, we go to Andrew, who's been waiting very patiently. Hi, Andrew.
Hi, how are you?
Good. Where are you calling us from?
Gravesend?
Gravesend, beautiful area. Low on restaurant, not too much in the restaurant field, right?
Yeah, Florentino's over there.
Very nice place, Fiorentino's. Like it a lot. But tell me your New Year's resolution.
To exercise more.
You don't exercise right now?
Not as much as I like to.
So what, you run outside? What do you plan to do?
Well, I belong to a gym. Maybe get to the gym more often.
Very good. It's good. You can't lose with that. So what's the question?
About the medication, I believe it's Metroprolo.
Okay.
It's for the heart. What is it used for, and are there any long-term side effects, like on the kidneys and liver?
Okay, we've got Dr. Nikitin is going to take that one.
Okay, metoprolol is a major medication actually existing right now for blood pressure control and for coronary artery disease. The medication works in two directions, lower the blood pressure and also slow the heart rate. Why it's important? Because the faster your heart working, the more it's working, the faster it beats, eventually it gets tired. It's not precluding you from exercise, but in a routine, when you sleep, when you're doing something. So metoprolol actually decreases the heart rate and decreases the work your heart doing. It does not affect liver or kidney in the long term. The major side effects, again, depends on how old you are. Very rarely happen is erectile dysfunction. There are some of the medication from the same group, from group of metoprolol, which is supposed to not affect the erectile function. But again, that is a major medication we use in cardiology right now.
Are you taking any? Are you taking that, Andrew?
Yeah, I went to the hospital, I believe, a few months ago with what they described as a extra heartbeat or skipped heartbeat. I was getting like palpitations, so I'm taking one a day for 50 milligrams.
Are you having any problems that Dr. Nikitina mentioned?
No, not at all.
Good.
Again, it's a medication which was existing for a long time. It was on the market probably for more than 30 years, and it's used in many millions of people. It's pretty safe.
Okay, thank you.
Thanks, Andrew. Have a great year.
You too.
Okay, we're now looking at a possible winner of the quiz, but don't rip up your tickets. We're going to go to Geraldine and see what she has to say.
Hi, Dr. Garner. Congratulations on your anniversary.
10th year, 10 years. Amazing, right?
Yes, it is.
I looked much younger when this started, but what are you going to do?
Okay.
So where are you calling us from?
I'm calling from Manhattan.
Wow. Did you just move there recently?
Yes.
I remember.
Okay.
How's the new place?
It's wonderful. I'm so happy here.
You like it? Where were you from, Queens?
No, Brooklyn.
Brooklyn. Oh, you had to leave Brooklyn. I'm sorry about that.
I know. Okay.
Where do you get the newspaper late at night? You have a place?
I don't ever get the newspaper.
Oh, okay. But I understand you think you have the answer to
Yes.
this. Now wait, we have a little drum roll. So I'd like you to hold off a second. Let me hear that sound effects. Wait. Could you hear that?
Yes, I heard
That's my
it.
heart beating. Very
Okay.
excited here. What do you think? Now take the one letter, the word, add a letter to it. It goes from 1 syllable to 3 syllables. What is it?
The word is R-A-R-E, and it goes to area, A-R-E-A. Is that it?
Absolutely correct. Correct. The first winner of the 10th season of the Ask the Doctor plaque.
Okay, great.
Do you have others?
Excuse me?
Do you have another plaque at home?
I didn't get it the last time. It doesn't matter, though, but yesterday they gave me a notice that I won on the Christmas trivia, so I'm waiting for that package.
So you're going to get that, and then you're going to get 2 plaques now.
Okay.
Okay, I'm going to have Miss Lapatosa, our quizmaster, get that out tomorrow.
Okay.
It's great. I hope you love where you live, and thanks for calling.
Thank you.
Take care.
Good luck. Bye.
Thank you. Geraldine, quite a guesser. Good guess. I don't know if any of you out there heard about the Christmas quiz, but we had a Christmas quiz going on, and next year, look out for that, okay? Yvonne?
Hi.
Hi, Yvonne. How are you?
I'm well, thank you.
Where are you calling us from?
Crown Heights.
Crown Heights. I like that name, Yvonne. It has a nice French look to it.
Thank you very much.
Yeah. So what's your New Year's resolution?
My New Year's resolution is to live for this moment, not to think about what I have to do next.
I like that. You're a woman
Thank
after my
you.
own heart. You're not going to let that bog you down, the problems of tomorrow, because you're going to enjoy today.
Amen.
Amen. What do you say? Amen. Thank you. What can we do for you?
Well, I'm in the medical profession, and I'm on my feet all the time. So I have a pain in my knee, sometimes like a burning sensation.
A burning sensation? So you're
Yes,
on your feet.
sometimes it burns me, yes. I'm on my feet all the time.
Do you have
constantly.
comfortable shoes?
I have comfortable shoes, yeah.
Okay, so I'm going to ask the panel members if they have any suggestions for, number 1, finding out what's going on, and number 2, helping to stop it. So let's start with Dr. Casina.
So you have, where is your pain exactly? It's feet, knees, entire legs?
On my knee, just on my knee, my right.
Both knees, right? And it's a pain.
No, just one knee, just the one knee, the right knee.
Right knee, it's a burning pain, right, you said?
Sometimes it's burning, yes, and it wakes me up at night.
Right. Is it, does it hurt you more when you walk? Or when you
Not
go
really,
upstairs, downstairs?
Yes, when I go upstairs, sometimes.
All right. Is your knee swollen or red?
No, it's not swollen or red now.
Have you ever fallen on that knee?
No.
And how long is the problem?
It has been for a while, like over 6 months.
All right. I mean, the way you describe it, it sounds like you probably have osteoarthritis of the knee.
Oh, okay.
And the next step is, again, as I always advise is that you see your doctor. And because the first step is usually the detailed examination of your knee, probably the x-ray. And depending on what it shows, your doctor may prescribe you maybe additional testing or just the pain medications, anti-inflammatory medications, physical therapy.
Good. Dr. Stevens, you want to add anything to that?
I think that's an excellent place to start. You can see your doctor, and it might be something as simple as an early osteoarthritis, which will require, just like Dr. Cosina said, some physical therapy, some anti-inflammatories. So hopefully you get to see a doctor and get it taken care of.
Thanks, Yvonne.
Exercise would help?
Exercise would definitely, I think
exercise would definitely help. But again, first step would be seeing your doctor, because again, this is a symptom that most likely related to the osteoarthritis, but it can be the presenting symptom of some other diseases.
Yvonne?
Yes.
Is your weight okay?
My weight is great.
Good, because that could be some people just by losing 5 pounds.
My weight is great.
So are you listening to the show for a long time?
No, I just turned on and I saw your show. I thought, ooh, this is interesting.
Oh, thanks a lot for calling. You're going to call back next week, and next week we actually have a rheumatologist, so maybe we'll get some additional information.
Very well. Thank you so much.
Have a great New Year.
Thank you. You too.
Okay. We're now going to go to Nancy. Hi, Nancy.
Hi.
Hi, where are you calling us from, Nancy?
I am calling from Williamsburg, Brooklyn.
Oh, that's a hip neighborhood right now?
Yes.
A lot of good restaurants in that neighborhood.
Okay, yes.
Yeah. And I want to ask you about, we're sticking to New Year's resolutions tonight. So what's your New Year's resolution?
My New Year's resolution is to be able to eat again, because I haven't been able to eat like for 2 months.
Wow.
Because I was diagnosed with this problem that I had that I can't find a cure for, and I'm going crazy.
Tell us a little bit about it.
It happened. I worked at St. Lutheran's Medical Center, and I was experiencing that when I would have lunch, my stomach would swell, and I would feel like I had a big dinner. and I went to the gastro doctor, and he did a endoscopy and a colonoscopy, and he diagnosed me with ileocecal valve.
Irritable bowel.
Yeah,
Irritable bowel syndrome.
No, not irritable bowel. No, ileocecal valve. V-A-L-V-E valve.
Oh, ileocecal
So
valve.
Yes.
problem or?
Okay, okay. And what did he do for you?
Nothing. He just told me that I should eat in small portions. That to get some antidepressant pills, and to that there was nothing that he can do. And,
Are you depressed?
I'm very depressed. I've been I lost my job because I can't go back to work, and I cry every day because every time I eat, my stomach starts swelling up.
All right, there's a number of problems going on here. We have great doctors. Let's get their opinion. Dr. Stevens?
Hi, Nancy. Sorry to hear about this. Did the gastroenterologist also do a colonoscopy as well?
Yes, he did a colonoscopy, and that's how he found out that
Okay.
I had that problem.
So, I'm not sure exactly what the problem you're describing is. The ileocecal valve is a normal piece of anatomy that everybody has, so there may be a problem with your ileocecal valve. But I think you should talk to your gastroenterologist, maybe find out a little bit more about your diagnosis so you can do a little more research and maybe ask him for some more advice.
Dr. Katsina, what about a psychiatric issue here? She's depressed all the time.
I mean,
How about-
apparently, yes, there is some anxiety and depression. And a lot of times, anxiety and depression can manifest not only by the feeling anxious or sad and hopeless, but also the variety of so-called somatic problems. So people can have some abdominal pains, constipation, diarrhea, some heartburn. And it's possible based on, you've done multiple studies and you seem to be, and your doctors seem to be doing a very good job. But it is possible that the depression and anxiety contribute to your symptoms. So I think the next step, what you should do is, again, get a second opinion if you're not satisfied with the care that you're receiving, and if you still have some answers, you'll get a second opinion from the gastroenterologist. The next step would be to see the psychiatrist, or you can even speak to the primary care doctor regarding some antidepressant. And it's possible that you will get some help with the antidepressant medication.
Yes, see, but the whole thing is that when I eat, my stomach swells up on the right side, and it feels like it's going to explode.
Yeah, a lot of times the mind can do things to the bowel. There's connections there, nerve connections. Dr. Nicotina?
I think I agree with always we offer our patients. If you have any questions, if you're not sure what's happening and you are not explain what you have to do next, look for a second opinion and third opinion. It's always a good idea to see other doctors.
So that means that I should just get a second opinion
Don't
and
stop
find
there.
out if I have a cure.
Yes, absolutely. You should definitely get a second opinion.
All right, so you got to get a second opinion. You've got the numbers up on the screen. If we can help you get another doctor to evaluate it. But it can be improved. That's the thing, that you shouldn't despair, that this condition can be treated.
I hope so, because I even lost my job because of this problem. I've been home for 2 months already in this condition, and I'm also diabetic. So if I don't eat, I start feeling weak.
Please give us a call. You can call us after the show, and we'll get you hooked up with the right person.
Oh,
okay.
Thank you so much.
Okay, be well. Don't despair.
Thank you.
Okay, we're going to go to Elaine now. Hi, Elaine.
Yes, good night. Happy New Year.
Happy New Year, Elaine. Talk up because I can't quite hear you.
Happy New Year.
Happy New Year. Happy New Year. Did you have a nice celebration?
Well, I worked. That's the thing.
Oh, you working?
Yes, I worked that day.
Oh, well,
And my New Year's resolution is to give up fried food.
Fried foods?
Yes.
What's your favorite fried food?
Chicken.
Chicken. Are you going to definitely give that up?
Yes.
So far, you didn't eat any chicken yet, the fried chicken?
I started eating it bake and steam.
Excellent.
What was the last part of the last couple of
I heard
words?
KFC, I think.
Hmm?
Are you walking by KFC?
No, I work at the hospital.
Okay, very
I
good.
work near Popeyes.
Very good. So what can we do for you? I'd like to help you.
Yes, I have a well, I did an MRI, and it shows that I have a torn rotator cuff.
Oh, in the shoulder.
I've been to another doctor, got a second opinion, and he told me to do physical therapy. At the moment, I have 4 sessions done, so I want to know if physical therapy can cure a torn rotator cuff.
Dr. Stevens, can it be cured?
It's definitely a safe place to start. And it's very possible that with physical therapy, some anti-inflammatory medicine like aspirin, Advil, Tylenol, and things like that, that the rotator cuff can heal by itself without surgery. So it's definitely worth giving it a good shot and doing your best at physical therapy before you do anything more invasive. And if it doesn't work after a certain period of time, and that's for you and your doctor to talk about, then there may be something else to do, like a type of surgery. But it definitely is possible to cure it.
That's a good news, right?
Yes, thank you.
So you're are you getting physical therapy?
Yes, I have a couple sessions leave. So
beautiful.
Thank you very much.
Keep working. Happy New Year.
Thanks. Have a good night.
Thank you. We got to can't quite hear some of the people tonight. We've got to get them to talk up a little bit. Who are we going to go to next? We're going to go to Carol?
Yes.
Hi, Carol.
Hi.
How are you? I can hear you nicely. Where are you calling from?
I'm calling up from Marine Park,
Oh,
Brooklyn.
I was just out there the other night. I ate at the King's Plaza Diner.
Oh.
Nice place.
Very nice place.
For $21, you can't eat. They give you so much food, you can't eat. Am I right?
I know, yes.
Amazing place.
Yes.
So what's your New Year's resolution?
Okay, my New Year's resolution is to get my right knee fixed. I went for a knee replacement 4 years ago, and now it's still bothering me. And I went to the doctor, and he told me that I have an infection, okay? And he only went by the SID rate, which was 34, and the C-reactive protein was at 36.
Oh.
Okay? And I went for a bone marrow scan, and it says findings concerning for active infection involving the right mid-fibular plateau tuberosity, I think.
Yeah, the tibial tuberosity. It sounds like you have a little infection brewing there after the knee replacement.
Right. Now, can that be after 4 years, an infection like that?
Yeah, I'm going to turn to our panel. Either Dr. Gutsina, you want to?
No, we can start. So generally, when you have the knee replacement or hip replacement, any kind of a foreign body, so there is always a danger of acquiring some kind of an infection.
Mm-hmm.
It can occur right after the surgery, soon after the surgery, and even 4 years after the surgery, even though it's less likely.
Mm-hmm.
This is a very specialized question that you asked. And again, as I said, the infection is still possible. It is also possible that it may be non-specific inflammation, not necessarily infectious in etiology.
Right.
Because the sedimentation rate that you mentioned was, what, 34?
34.
Yeah, 34. It's not quite high, not high enough to accompany the real infection in a joint. However, you cannot only go by those numbers.
Right.
And now, did your orthopedist offer you to do some kind of a procedure on your knee?
Yes, an orthogram. Orthogram.
Mm-hmm.
Now, the orthogram said that it was fairly normal appearing joint space. There was no evidence of fistula formation or extra articular extravasation.
Right.
No periodicular abscesses were noted. There was no evidence of contrast at the metal bone or cement bone interfaces.
So it sounded like everything was pretty
Yeah, it
much intact.
sounded right, exactly.
Right.
And what did the
But I'm
orthopedic doctor
falling.
tell you?
I'm also falling. I broke my 10th rib. I broke my rotor cuff from my right arm, and I fell twice again after that. So I don't know what to do.
Carol, again, sounds like a second opinion.
Right,
I'm sorry,
yeah, second opinion. I think it's the very important thing for you to find out is what's causing your falls. Apparently, you have fallen multiple times, and the falls can be caused by a lot of different problems, starting from the cardiac problems, maybe mini strokes, maybe the arrhythmias. So I think what you should do again, just go to your doctor, and you should definitely get a detailed evaluation of the cause of your falls.
Dr. Stevens?
I think it's my
Carol?
knee that buckles.
Carol?
Yes.
Just want to get a quick opinion from Dr. Stevens on whether or not he's seen these 5 years later to go in and take the knee joint.
Like Dr. Katsuna said, whenever you have a foreign body there, it's possible for the rest of your life that it can get infected. So if that knee's bothering you worse than it has been over the past 4 years, then it definitely sounds like there may be a problem with it. It sounds like there may be some infection on one of those tests, so it might be worthwhile to talk to your orthopedist about the options. You may need just something as simple as some intravenous antibiotics that might cure the infection.
Dr. Nicotina, if there's an infection in the knee, is there any, anything which you need to take any antibiotics for any heart problems or any?
In the principle, not, because if heart valves are normal, there is no need for any antibiotics. And in general, there are no new rules that we don't take antibiotics for even big valve problems unless there was surgery on the valves.
Thank you. Thanks. I hope you get better soon, Carol. Give us a call if we can help you. We'll go to Dre now. Hi, Dre.
Hey, how you doing, Doc?
Dre, how you doing? Where you calling from?
I'm calling from East New York in Brooklyn.
Great area. I know that well. It's making a good comeback, right?
Yeah, it's very, very comeback now. The neighborhoods is looking good. The buildings are coming back. Everything's looking good.
Beautiful. I'm glad to hear it.
Yeah.
Now we got it. What's your New Year's resolution?
Just to quit smoking and try to get in a little better good shape.
Oh, you smoking?
I was, but I haven't been.
Excellent. Remember, we got to watch the weight. We talked about tonight increased risk of diabetes because people gain a lot of weight after they stop smoking.
I know, and then because I've been trying to cut down a little bit, and I realized I've been getting so weak, and I always need like a sugar rush to boost my energy back up.
You may have to see a doctor for some medication suppressant to suppress that appetite a little bit.
Okay, but let me ask you another question. Like when I was smoking, I would still have like this chest pain.
Okay.
And like only when I smoke, but when I don't smoke, I don't have it, and it's like a crack, like a cracking sensation, like when you crack a knuckle.
Let's ask Dr. Nicotina about the connection between smoking, chest pain, heart attacks. Dr. Nicotina, you want to give him a good lecture on that?
I'm very glad that you stopped smoking. In general, people who do smoke increase the risk of having heart attack and stroke. Why? Because nicotine itself activates inside of the vessel all cells, so cells are prone to clotting.
Okay.
So once you stop smoking, within 2 years, your risk of having a heart attack completely different and close to the same level as the people who don't smoke. Nevertheless, if you have any other risk factors, if your age above 50, if you have high blood pressure,
35.
high cholesterol, sugar issue, you should check with a cardiologist. Obviously, routinely, you should check with your primary care physician.
Okay, you're doing the right thing.
But now let me ask you, because now I'm trying to start running and do a little bit of jogging. Is it okay if I do that, or should I go see my doctor first?
What do you think?
I do recommend all my patients to have some kind of a checkup, routine stress test, simple stress test on a treadmill to make sure that everything is real stable. You never know how your heart will react to exertion, and you don't want to cut yourself in a bad situation when you start running and something bad happens.
Dre.
Okay. Yeah.
That's helpful, right?
Yeah, that's very helpful.
You know that Dre is a famous name, right? You got Dr. Dre?
Yeah, that's right.
You know that guy, yes. Cool guy, yeah.
Yeah.
Anyway, that's we'll call you now next time you call, okay?
All right, Doc. Thanks a lot.
Take care, Doc.
All
Take
right.
care.
Later.
Let's go now to Sharon. Hey, Sharon. Sharon.
Yes. Yes, this is Sharon from Lawrenton, New York.
Where's that?
Pardon me?
Where's that part of town?
That's in Queens.
Yeah, I can't quite place it. Where is it, near the racetrack?
Yes, close up there. Yeah, that
Not too
area.
far from. Do you like to go out to the track?
Yeah, well, they have a flea market I usually go to summertime.
Oh, at
That's
Aqueduct.
pretty good.
Yeah. It's nice. They're getting gambling in there now.
Yeah, I don't do all that gambling.
Good.
I like to shop.
Excellent, excellent. What's your New Year's resolution?
To lose my stomach. It's been a while.
That's tough. That can be tough, right? To lose the stuff. It's easy to lose weight.
I've been working out, doing a lot of, different things, sit-ups and watch my diet.
I want to ask Dr. Stevens.
I lose a little, but it's just like a flab, underneath, it's like everything just drops.
But what can maybe is it true that some of these require like liposuction or some kind of surgery? You can't lose that weight.
Possibly, Sharon. Just a couple of quick questions.
I was looking into. Matter of fact, I went for consultation about a laser liposuction. They call it smart lipo.
Yeah.
I wanted to know what's the big difference between the liposuction, where they put you to sleep. But this one, smart lipo, is just like, you're up and they do it for like 4 hours, 3 to 4 hours as a procedure. Does it take the same amount of fat out your stomach?
It's a good
or
question.
Effective as the other liposuction itself?
Right. Well, there are different types of liposuction. The plastic surgeon would do this procedure. And just like all the other procedures, now they're doing it minimally invasively. So they make small incisions, and they take suction catheters, and they basically suck out the fat from your abdominal wall. There's another procedure where they can remove part of the fat. That's called a tummy tuck or an abdominoplasty. So depending upon how much tissue you'd like to get rid of, and how old you are, and your health status, you should definitely talk to your plastic surgeon about your different options, but they're all good options.
It's interesting. Okay. So you think you might be going for that after your consultation?
Oh yeah. I mean, it's I was he was saying that it would be much better because this little small hole. Usually, if you have that liposuction, then they cut your stomach and all this, all that.
But you make sure you they got to go to someone who does a lot of these. You're going to somebody who's doing a lot of them?
Yes.
It's important to go to a good place.
Yeah, it is. It's a good place. It's an upscale place, basically. A lot of reviews, good reviews, never have any problems, basically. So, read up about this person.
Very good. If you ever need a second opinion, call us, and let us know how this worked out.
Okay, sure, I will. Hopefully by the end of the month, I should be,
Excellent.
I'll give you a call and let you know how it worked out.
We wish you the best.
Oh, thank you very much.
Take care. We now go to Paulette. Hi, Paulette.
Hi, Dr. Brian. How are you doing? I'm calling from East New York area.
Oh, we just had Dr. Dre was calling a little while ago.
Okay. Yes.
What can we do for you?
Yes, I'm calling from East New York area, and the problem I'm experiencing is that I'm having these numbness in my tip of my fingers, especially early morning. They feel like needles and pins. I have to massage my hand to get the back feelings. But the thing is this, I did went to the doctor, and he gave me gabapentin, 100 milligrams. That's how you pronounce it, Gabapentin. But it's not helping. Also, I have this pain in the back of my knees, just behind where you have probably the synovial fluid and my kneecap, and it's very, very painful, and I can't seem to get rid of the problem, and I have to use my hand a lot. I stand on my feet a lot. I climb like 94 steps 3-4 times a day, and the problem still persists. What can I do to fix the problem?
Did you hear Maddie's call at the beginning of the show with the ice fingers?
No.
Okay, let's see if we can. Who'd like to take that one? Okay.
So basically, a question consists of two questions, right? One is a numbness and tingling. It's both hands.
Yes, it is.
Right. So, and the second part of the question is your knee, right? So we'll just have very little time left. So I'll be very short.
Okay.
The problems, the tingling sensation in your hands can be caused by a lot of problems. It could be the problems with your neck, with the spine, right? It could be the carpal tunnel syndrome, and it could be the neuropathy caused by some other problems, such as thyroid problem, diabetes, and so forth.
So I'm sorry we're short of time. Please call us back next week, but I hope that answers your question, and we'll get back to you next week, okay?
Yes, thanks a lot.
Hi, Debbie. Debbie?
Yes,
Hi.
hello.
Thanks for holding on. You're the last caller of the first show of the 10th season.
Oh, okay.
So tell us quick. I want to answer your resolution, but what can we do for you?
Well, I'm in Bensonhurst, and I was diagnosed with multiple sclerosis about 8 years ago. It's remitting, relapsing. And I'm on a therapy, injections, interferon 3 times a week. And after all these years, I'm just wondering if I need to take the injections, would it make a difference with my condition.
I'd love to get into that. It's impossible. We just ran out of time, and it's such an important question. I promise that you will be the first caller next week.
Okay.
If you call in at 5 to 8 next week, we're going to put you on first.
Okay, that's fine.
Okay?
Thank you so much.
Okay, and Happy New Year.
And Happy New Year to you all.
Thanks. I mean, the show just ran away from us. I'm sorry. It was such a popular show. I want to thank our guests, but I want to stress again, Dr. Nikita in his office, if anybody needs evaluation of the arteries of their heart by CAT scan, it's an amazing place. You got to go there just to look at it, even if you're not going for an angiogram, because it's science fiction that you can, and without getting an angiogram, you can evaluate the arteries of the heart. Amazing. So that's it for the first edition of this new decade for us, and I'd like to thank Dr. Anastasia Nikitina, Dr. Marguerite Cosina, Dr. Daniel Stevens for coming in. It's good to remember you should always be proactive about your own health. You speak to your doctors about your concern. Go for second or third opinions. In the meantime, continue to watch the net and visit the forum at netny.net/askthedoctor. Thank you for your calls tonight, and I'll see you again next week. Goodbye, stay healthy, and I'll see you in the tablet. And Happy New Year.